Over half of men over the age of 40 will notice changes in their erections. For some, it feels like it takes longer to get going. For others, firmness isn't what it used to be, or staying power isn't as reliable. And yet, here's the surprising truth: these changes are not always inevitable. They are not simply the price of aging. At the same time, many women in this age group are going through their own transformations: vaginal dryness, discomfort, pelvic changes that can make intimacy feel different, even distressing. What often gets missed is that both men and women are experiencing shifts rooted in the same underlying biology, hormones, blood flow, and the health of the pelvic tissues. And that's exactly where today's conversation begins. Because here's something you might not expect me as a urologist to say: what you put into your daily cup of tea can actually have measurable effects on your sexual health, even into your 70s and 80s. Yes, tea. Something as simple, as ordinary, as comforting as that warm mug you hold in your hands every morning. And no, I'm not talking about gimmicks, exotic powders, or internet hacks. I'm talking about clinically studied, natural ingredients that have been tested in respected research institutions like Mayo Clinic, Harvard, and through peer-reviewed studies in urology and endocrinology. Let's set the stage clearly. Erections are not just about testosterone or desire. They are about blood flow, nerve signaling, endothelial function, the tiny, delicate lining of your blood vessels, and the resilience of the pelvic muscles that support the genitals and bladder. Think of it like this: your penis or your partner's is the check engine light for your vascular system. When erections weaken, it often means the same blood flow challenges that affect the heart and brain are starting to show up in the pelvic area first. Now imagine if you could nourish those blood vessels daily, protect them from the wear and tear of aging, and give your pelvic tissues the same kind of support you'd want for your skin, your joints, or your brain. That's where certain teas enhanced with very specific plant compounds and nutrients can play a role, not as a magic bullet, but as one part of a much bigger picture of lifestyle, hormones, and self-care. And let me be clear, your body isn't broken if you're noticing changes, it's just communicating. What we're doing today is learning how to listen and how to respond with simple, evidence-based choices that can make intimacy vibrant again at any age. So, in this consultation, we're going to explore 6 essential insights. We'll uncover why erectile strength is tied so closely to vascular health, what teas and natural compounds show real promise in peer-reviewed studies, how stress and pelvic floor weakness silently undermine sexual performance, and why women's sexual health deserves equal airtime in this conversation. We'll break down myths, highlight truths, and give you small, practical steps you can start today. This is not about shame. This is not about selling you an overnight cure. This is about equipping you with the science, the compassion, and the clarity you deserve. You'll walk away not just knowing what to add to your tea, but why it works, how it integrates with your body's physiology, and what else you can do to support your sexual vitality into your 70s, 80s, and beyond. So let's dive in together without judgment, just truth. Let's start with the foundation, understanding why erections are really about blood flow and why that matters so much as we age. This is something I talk about with patients almost every single week. Erections are a vascular event. They depend on healthy arteries that can deliver blood quickly and efficiently to the penis, healthy veins that can keep it there, and an endothelium, that inner lining of blood vessels that responds to nitric oxide. Nitric oxide is your body's natural yes signal for blood flow. Without enough of it, or if the blood vessels are stiff and resistant, erections become weaker or slower to respond. Think of your vascular system like a network of garden hoses. When you're young, those hoses are flexible and smooth on the inside. Water flows easily. Over time, with exposure to high blood pressure, cholesterol, diabetes, smoking, and even chronic stress, those hoses become stiffer and narrower. The water pressure drops. The first place you see the difference? Often it's in the penis. Research from the Cleveland Clinic shows that erectile dysfunction can be an early warning sign for cardiovascular disease by as much as 3 to 5 years. Now, where does tea come into this? Tea, especially green tea and certain herbal blends, is rich in compounds called catechins and flavonoids. These are plant antioxidants that improve endothelial function, meaning they help that inner lining of the blood vessels release more nitric oxide. A 2020 meta-analysis published in the Journal of Nutritional Biochemistry found that regular green tea consumption improved flow-mediated dilation. That's a fancy way of saying it improved how well blood vessels can relax and let blood flow through. But it doesn't stop there. Green tea also helps reduce oxidative stress, the kind of cellular rust that accelerates vascular aging. Imagine wiping away a layer of grime from the inside of those garden hoses. That's what antioxidants do. And in men, better blood flow means not just improved erection quality, but also potentially better prostate health and urinary flow. For those who aren't fans of green tea, there are other options. Hibiscus tea, for example, has been shown to lower blood pressure in several randomized controlled trials. Lower blood pressure means less strain on your arteries and improved long-term circulation. Pomegranate tea or pomegranate peel infusions are another excellent option. Studies show they boost nitric oxide and have anti-inflammatory effects that protect the endothelium. Here's something to try. Replace just one of your daily sugary drinks or second cup of coffee with a high-quality, unsweetened green tea. Steep it for at least 3 minutes. That's when you really extract those catechins, and consider adding a squeeze of lemon, which boosts the absorption of its antioxidants. This small, consistent change can start making a difference over weeks and months, not just days. And remember, this is not a standalone fix. I always tell my patients tea is a tool, not a cure. You still need to pay attention to blood pressure, cholesterol, blood sugar, and physical activity. Even walking 30 minutes a day improves erectile function because it trains your arteries to be more responsive. So as we continue this conversation, I want you to start thinking about tea not just as a comfort drink, but as part of your vascular care plan. Every sip is a vote for better blood flow, for your heart, your brain, and yes, your sexual health. If this resonates, drop a comment below. You're not alone. If you've been wondering whether what you drink every day actually matters, and if you want more science-backed tips like this, subscribe so you don't miss the next part of this series. Now that we've built a foundation around blood flow, let's talk about another hidden player that has a massive effect on erections and on sexual satisfaction for both men and women's stress in the pelvic floor. This is something I hear so often in clinic. Doc, I'm eating right, I'm exercising, but things still aren't working the way they used to. When we dig deeper, we find that chronic stress, anxiety, and tension are at the root. And here's why. When your brain is under constant stress, your body produces higher levels of cortisol and adrenaline. These hormones are lifesavers in short bursts. They help you escape danger, but they are terrible for long-term sexual health. They constrict blood vessels, reduce nitric oxide production, and can suppress testosterone. Think of it this way. Your body is like a house. When the smoke alarm is constantly blaring that stress, the house doesn't care about turning on the mood lighting, it's just trying to keep you alive. Erections, orgasm, lubrication, those are luxury features your body turns off when it feels unsafe. And then there's the pelvic floor, the sling of muscles that holds up the bladder, prostate, uterus, and rectum. These muscles don't just keep you continent, they're also critical for sexual function. They trap blood in the penis during an erection and contract rhythmically during orgasm. But here's the problem. Chronic stress often leads to a tight, overactive pelvic floor. For men, that can mean difficulty maintaining erections, premature ejaculation, or even pelvic pain. For women, it can cause pain with penetration, burning, or urinary urgency. Research from the International Journal of Impotence Research has shown that pelvic floor physical therapy can improve erectile function significantly, sometimes as much as oral medications. And for women, pelvic floor therapy can restore comfort during sex, improve arousal, and even help with orgasmic function. So how does tea fit into this picture? Certain teas like chamomile, lavender, and passion flower have mild calming effects, helping reduce the stress response and support better sleep. Sleep is when testosterone production peaks, when cortisol levels reset, and when your pelvic muscles naturally relax. A nightly ritual of a calming caffeine-free tea can be a small but powerful signal to your nervous system it's safe to let go. Here's a practical tip. Try a short tea and breath ritual before bed. Brew a cup of chamomile tea, sit somewhere quiet, and take 5 slow, deep breaths while you hold the warm mug. Focus on letting your belly expand as you inhale, then soften as you exhale. This simple practice lowers sympathetic nervous system activity, that fight or flight mode, and nudges you toward the parasympathetic rest and digest mode, which is where sexual arousal becomes possible. If you're dealing with pelvic floor symptoms, whether that's difficulty maintaining erections, pelvic pain, or pain with sex, bring it up with your doctor. Ask if pelvic floor physical therapy might be right for you. It's not just for postpartum women or people with incontinence, it's an incredibly underused tool for sexual function at every age. So the takeaway here is twofold. Support your nervous system daily with calming habits, and don't ignore the health of your pelvic floor. When you combine those with the vascular support we talked about earlier, you create the perfect environment for strong, reliable, pleasurable intimacy, even as you get older. And if this section made you pause and think, oh wow, that might be me, let me reassure you, this is common and it's okay to talk about it. Your body isn't broken, it's just misunderstood. We've talked about blood flow and stress, but now let's dive into hormones, because no conversation about sexual vitality is complete without them. This is something I often explain to my patients. Hormones are like the conductors of your body's symphony. Testosterone, estrogen, progesterone, thyroid hormones, they all work together to set the tempo for your mood, your energy, and yes, your libido and erections. When one instrument is out of tune, the whole symphony sounds off. For men, testosterone plays a major role in sexual desire and erection quality, but maybe not in the way you think. Low testosterone doesn't always cause erectile dysfunction directly. Instead, it can lower libido, which means fewer spontaneous erections, which can lead to weaker nighttime and morning erections. Over time, this can contribute to a decline in penile tissue health. A large review from the Journal of Sexual Medicine found that restoring testosterone to healthy levels in men with confirmed low T improved sexual desire, erection frequency, and response to PDE5 inhibitors like sildenafil. But here's what's fascinating. Estrogen matters too. Men produce a small amount of estrogen by converting testosterone into estradiol, and that estrogen is crucial for bone health, brain health, and even vascular function. Too little estrogen can lead to joint pain, fatigue, and a decline in nitric oxide production. Too much, on the other hand, often seen in men with high body fat, can suppress testosterone and contribute to erectile challenges. For women, estrogen is like a built-in moisturizer. It keeps the vaginal tissues plump, elastic, and well lubricated. As estrogen declines, whether from menopause, birth control, or certain medications, dryness and pain with intimacy can become more common. That discomfort can create a feedback loop. Sex becomes painful, so arousal decreases, and over time, libido takes a hit. Here's where nutrition and tea play a surprising supporting role. Green tea catechins may help lower excess body fat and improve insulin sensitivity, which supports healthier testosterone to estrogen balance. Spearmint tea has been studied in women with PCOS for its ability to modestly lower androgen levels, which can be helpful in cases of unwanted hair growth or acne, though it's not recommended for men trying to raise testosterone. Another powerhouse option, ginseng tea. Several randomized controlled trials have shown that Panax ginseng can improve erectile function by boosting nitric oxide production and mildly increasing testosterone levels. In fact, a 2021 meta-analysis reported that men taking ginseng had significant improvements in erection quality compared to placebo. You can even get more targeted by adding L-citrulline, a natural amino acid, to your tea. Citrulline is converted to arginine in the body, which helps produce nitric oxide. Studies show it can improve hardness scores and blood flow in men with mild erectile dysfunction without the side effects of prescription medications. Here's a practical step. Consider making an erection support tea blend. Start with a base of green or hibiscus tea, add a slice of fresh ginger for circulation, and stir in a small amount of pomegranate juice after steeping. If you tolerate supplements, you could add L-citrulline powder, usually 1-3 grams per day. This blend supports vascular health, antioxidant status, and nitric oxide production all at once. But here's the key. You want to pair these strategies with routine hormone checks, especially if you're over 40. Ask your doctor to check total testosterone, free testosterone, estradiol, and SHBG, sex hormone, binding globulin. For women, discuss whether vaginal estrogen therapy, DHEA, or other hormone support might restore comfort and desire. Hormonal balance isn't just about sex, it's about quality of life. When hormones are optimized, sleep improves, mood stabilizes, muscle mass is easier to maintain, and energy comes back. And when all of that is working well, intimacy tends to follow naturally. So the takeaway, don't guess when it comes to hormones. Test. Then use a mix of medical support and daily rituals like hormone-friendly tea blends to keep your levels where they should be. Now let's talk about something that's completely within your control, your daily habits. This is where I remind patients that no supplement, no tea, no pill will ever outperform the basics. And the great news, these basics are incredibly effective, sometimes more effective than prescription medication when done consistently. One of the strongest predictors of erectile function isn't age, it's activity level. Research from the Harvard School of Public Health shows that men who exercise vigorously for just 30 minutes a day were 41% less likely to develop erectile dysfunction compared to sedentary men. Why? Because exercise improves blood vessel health, lowers blood pressure, balances blood sugar, and raises natural testosterone. It also boosts mood and lowers stress, all critical for sexual function. Think of exercise as the ultimate sexual health pill. It improves blood flow, strengthens the heart, and even conditions the pelvic floor. And you don't need a fancy gym to start. Walking briskly for 20 to 30 minutes most days is enough to begin retraining your blood vessels. Add in a few strength training sessions per week, body weight squats, push-ups, resistance bands, and you're already improving testosterone production and metabolic health. But there's another layer I want you to consider: pelvic floor training. Remember, these muscles are like the trap door that holds blood inside the penis during an erection. If they're weak, erections may not be as firm or may fade quickly. If they're overactive, they may contribute to pelvic pain or premature ejaculation. Pelvic floor exercises, also known as Kegels, can make a huge difference, but they have to be done correctly. For men, that means engaging the muscles you'd use to stop the flow of urine midstream, holding for 3-5 seconds, then relaxing fully. Repeat this 10-15 times, 2 to 3 times per day. A 2019 study in physiotherapy showed that men who did a structured pelvic floor program for 3 months had significant improvements in erection rigidity and sexual satisfaction. Women benefit just as much, especially after childbirth or during menopause, when estrogen loss can lead to pelvic floor weakening. Strengthening those muscles not only helps with bladder control, but also increases blood flow and sensitivity in the genital area. And here's where tea can actually complement these efforts. Hydration matters. Dehydration makes blood thicker, harder to circulate, and can even trigger muscle cramps, including in the pelvic floor. Swapping sugary sodas or energy drinks for herbal or green tea keeps you hydrated, delivers antioxidants, and supports cardiovascular health all at once. Here's a simple, actionable habit stack. You can try: brew a large mug of tea, take it with you on a 15-minute walk, and finish it when you return. This pairs hydration, movement, and vascular support in one daily ritual. Over time, these small, consistent actions create a compounding effect that supports your erections, your hormones, and your overall energy. And let's address a common myth I hear from patients. I don't want to do Kegels because I'm afraid it will make things too tight or make my symptoms worse. The truth is, correctly performed pelvic floor training improves both strength and relaxation. It's about control, not just contraction. If you're unsure whether you're doing them correctly, a pelvic floor physical therapist can guide you, often with biofeedback, so you can see exactly which muscles you're engaging. So think of exercise and pelvic floor work as your prescription-free, side effect-free daily medicine. They amplify every other intervention we've discussed, from T to hormones to stress management, and they empower you to be an active participant in your sexual health. Before we move into the last set of strategies, we need to clear the air because when it comes to erections and sexual health, there's no shortage of myths and quick fixes online. And many of these so-called solutions not only waste your money, but can delay you from addressing the real underlying issue. Here's something I hear all the time in clinic. I tried that supplement I saw online. It said it would fix ED in 7 days, but nothing changed. The truth? Most over-the-counter supplements that claim to boost testosterone or give you instant virility are not backed by peer-reviewed research, and some have even been found to contain hidden prescription drugs or unsafe fillers. The FDA has warned multiple times about herbal Viagra products sold online that actually contain unregulated doses of sildenafil or tadalafil, which can be dangerous if you have heart disease or take nitrates. Another big myth is that testosterone replacement is the answer for every man with ED. While testosterone therapy can be life-changing for men with confirmed low levels, it is not a universal cure. If your testosterone is already normal, adding more will not necessarily improve erections, and in some cases, it can raise red blood cell count or affect fertility. That's why I always encourage patients, test, don't guess. A simple blood test can tell you if hormones are truly the issue. Then there are the shockwave and PRP treatments marketed in some clinics as miracle cures for ED. While early research is promising, these therapies are still considered experimental by the American Urological Association, and results can vary widely. They can also be expensive, sometimes thousands of dollars out of pocket, and are best pursued only under the care of a urologist who specializes in sexual medicine. And let's not forget the myths that affect women. I often hear from female patients, pain is just part of getting older, or there's nothing I can do about dryness. Neither is true. Vaginal pain and dryness are treatable, whether through topical estrogen, DHEA, moisturizers, lubricants, or pelvic floor therapy. Sex should never be painful, and if it is, it's a signal to get evaluated, not something you have to tolerate. So how do we separate fact from fiction? Stick to interventions that have been studied in reputable journals and recommended by professional societies like the AUA, American Urological Association, ACOG, American College of Obstetricians and Gynecologists, and ISSM, International Society for Sexual Medicine. The strategies we've discussed so far, improving blood flow through tea and nutrition, managing stress, balancing hormones, strengthening the pelvic floor, exercising regularly, all have solid evidence behind them. Here's a practical filter you can use when you see a new product or claim. Ask for studies. Are there peer-reviewed clinical trials? If the company can't point to published data, be cautious. Watch for red flags. Words like instant, miracle, or secret formula usually mean marketing, not medicine. Check ingredients. If a supplement hides behind a proprietary blend, you don't know how much of each ingredient you're getting. Talk to your doctor. Even natural remedies can interact with medications or affect blood pressure. Myth busting is empowering because it saves you time, money, and frustration. Instead of chasing the next internet trend, you can focus on building a daily routine that's actually supported by science and that will keep paying dividends for years. If you've ever fallen for one of these myths, don't feel bad, you're not alone. These products prey on the fact that sexual health is still a taboo subject, and many people feel too embarrassed to ask their doctor for help. But you deserve better than false promises. You deserve strategies that truly work. We have laid the groundwork with blood flow, hormones, lifestyle, and myth busting. Now let's explore some of the more advanced strategies, the things I often share with patients who are ready to take their sexual health from good to great. One of my favorite areas of research right now is adaptogens, natural plant compounds that help your body adapt to stress. Chronic stress is a major libido killer and blood flow disruptor. So supporting the stress response is a smart way to improve sexual vitality. Ashwagandha, for example, has been shown in multiple clinical studies to lower cortisol and modestly increase testosterone in men with suboptimal levels. A 2019 randomized controlled trial found that men taking ashwagandha experienced improvements in sperm quality, sexual satisfaction, and testosterone compared to placebo. While you don't brew ashwagandha like a tea in the traditional sense, you can find powdered root extracts that dissolve well into warm tea or milk before bed, a perfect part of your nighttime wind-down ritual. Another adaptogen worth mentioning is rhodiola rosea. Studies show it may reduce fatigue, improve endurance, and enhance mental focus, which indirectly supports sexual performance. Some patients describe feeling more ready and less mentally distracted when using rhodiola during times of high stress. Then there are amino acids like L-citrulline and L-arginine. We mentioned citrulline earlier, but it's worth highlighting that a combination of these two amino acids can boost nitric oxide production even more effectively. A small but compelling study in urology found that men with mild ED who took citrulline daily reported firmer erections and improved satisfaction after just 1 month. Mixing citrulline into a citrus-based tea or a post-workout beverage is a simple way to incorporate it into your daily routine. Timing matters too. If you're drinking green or black tea, aim for earlier in the day, since caffeine can interfere with sleep if consumed too late, and poor sleep is a direct testosterone killer. For evening, switch to caffeine-free options like chamomile, hibiscus, or rooibos. If you're experimenting with ginseng or adaptogens, morning or early afternoon is best to avoid interfering with sleep. You can even build a sexual health tea routine. Morning green tea with lemon for catechins and antioxidant boost. Midday hibiscus tea or pomegranate infusion for vascular support and gentle blood pressure lowering. Evening chamomile tea with ashwagandha or magnesium powder for relaxation, cortisol reduction, and improved sleep quality. This creates a rhythm that supports blood flow, hormonal balance, and stress regulation across the entire day, rather than just taking one pill or supplement and hoping for the best. And for women, many of these same strategies apply. Adaptogens like maca root have been studied for their ability to improve arousal and sexual satisfaction, particularly in postmenopausal women. Maca powder can be added to a warm latte-style tea in the morning for a gentle hormonal support. A quick word of caution: while these compounds are generally safe, they're not for everyone. If you have autoimmune conditions, take blood thinners, or are pregnant or breastfeeding, check with your healthcare provider before starting adaptogens or high-dose amino acids. The exciting part of this advanced approach is that it puts you in the driver's seat. You're not waiting for a prescription or a one-size-fits-all fix. You're customizing your daily routine to match your body's needs. That's how you build not just better erections, but better health, period. So let's bring this all together. We've covered a lot, and if your mind is spinning a little bit right now, that's okay. Let's slow down and make this simple. Strong erections and healthy sexual function overall are not just about age or luck or taking a pill. They're about blood flow, hormones, stress, muscle tone, and the choices you make every single day. Your daily tea can absolutely be part of this plan, not because it's magic, but because it delivers antioxidants, plant compounds, and calming rituals that nourish your blood vessels, your nervous system, and your hormones over time. Here are the truths I want you to walk away with today. Erectile changes can be an early warning sign about cardiovascular health, and that SIP's an opportunity, not a punishment. It SIPs your body saying, let SIPs pay attention now before something bigger happens. Tea, especially green tea, hibiscus, pomegranate, and ginseng, can improve blood flow, lower oxidative stress, and support nitric oxide production, which is the foundation of a strong erection. Stress and pelvic floor tension are silent saboteurs. Calming rituals, breathing exercises, and pelvic floor therapy can dramatically improve sexual function for men and women alike. Hormonal balance matters, and it's not just testosterone. Estrogen, cortisol, thyroid hormones, they all play a role. Test, don't guess. Exercise is medicine. A daily walk, a few strength training sessions a week, and targeted pelvic floor training are some of the most powerful free tools you have. Most internet cures are not cures at all. You deserve evidence-based solutions, not gimmicks or risky shortcuts. And most importantly, your body isn't broken. If you're struggling with intimacy, it doesn't mean you failed, it means you're human. These challenges are common and they are treatable. So here's my challenge to you. Pick just one thing from today's conversation to start this week. Maybe it's swapping your afternoon soda for hibiscus tea. Maybe it's 5 minutes of breathing before bed. Maybe it's finally making that appointment to check your hormones or talk to a pelvic floor specialist. Small steps are what create lasting change. And if this conversation helped you see your health in a new light, stay curious, stay informed, because the more you understand your body, the less fear and shame control the narrative. If you're watching this and thinking I needed to hear this, you are not alone. Leave a comment, share your experience, and let's build a community where we talk about these things without embarrassment. And of course, if you want more grounded, judgment-free health education, not clickbait, not hype, subscribe and join me here every week. Your body is worthy of care. Your intimacy is worthy of attention. And you are worthy of feeling confident, connected, and fully alive at 40, 60, even 80 and beyond. Stay curious, stay compassionate with yourself, and I'll see you in the next video.